Are you struggling with hot flashes, night sweats, mood swings, but not ready for hormone replacement therapy? Or you just can't take it? Or you just don't want to? The good news, there are clinically proven non-hormonal options that can help you feel like yourself again. And today we're going to break down the top ones I recommend as a doctor and that I talk to my patients every single day about. I'll share some science-backed insights and what actually works. And you'll be able to figure out what works for you and then find a great strategy with your provider. Let's get to it. Okay, so my first tip is always starting with the foundation. Lifestyle changes. I know it sounds simple, and I know that basically people hear this all the time, but honestly, the evidence is really, really strong. An anti-inflammatory diet can decrease hot flashes, can decrease inflammation, can overall help with metabolism, with losing weight. It really can't be understated that nutrition is the foundation for hormone health. We need to have adequate nutrition to make our hormones, to use them, and then to lose them. So estrogen metabolism is dependent on your gut and your gut health. So what diet specifically? So studies show that a Mediterranean style diet, which is rich in vegetables, fruits, good healthy fats, whole grains, will help lower vasomotor symptoms. And when I say vasomotor symptoms, I mean hot flashes and night sweats. In fact, there was a study done in 2013 that is actually published in the Menopause journal that found that women who are plant-forward diet have 20% fewer hot flashes than women that do not. And plant-forward diet just means that most of your diet is actually plants, not vegan, not vegetarian, but that most of your diet actually is, you look at your plate and half is fresh vegetables. So what are the top 5 foods for a menopause diet? What are the ones you need to put in that anti-inflammatory diet? Because anti-inflammatory is just a really broad range. It's not specifically one diet. It's actually more of like a lifestyle in eating. So like paleo goes underneath this, Mediterranean goes underneath this. There's kind of a lot of different types of diets per se. I hate the word diet in general, so I generally like to say just an eating style or a lifestyle. So what do you need to have? You need to have those top 5 fab foods. So first, omega-3 healthy fats. I prefer avocado and olive oil because they have a lot of other great nutritional benefits like fiber. Olive oil is great because it has polyphenols. And so those are important to make sure that you put in your diet. 2, fiber, 25 to 35 grams. This by far is the thing that I find the hardest, even for myself. When I actually started charting it with a chronometer, I noticed I was getting between 10 and 15 grams, and most women are pretty low on fiber. So food first always, but if for some reason you can't get it, like I frankly just can't remember in the morning to put enough chia seeds or hemp seeds, so I often have to take a fiber supplement. But 25 to 35 grams is what you're aiming for. And you want to make sure that you're not going too fast, because if you get too much fiber too fast, you're going to bloat and be really uncomfortable. So low and slow is the name of the game. Protein, protein, protein. I'm sure if you're ever on Instagram, you hear protein, protein, protein from everybody. The minimum is 30 grams every meal, but you want to aim for 1 gram of protein per ideal body weight. So if your ideal body weight is 130 pounds, you're really aiming for 130 grams a day. Plus or minus, there are ways to customize this for you if you're someone who's an athlete or maybe older, say 70 or 80. There are different ways to sort of pick what protein you need, but start first with 30 grams a meal. If you're not getting that, that's the basics. So start first with the basics. Number 4 is colorful vegetables. The more, the better. And number 5 might be surprising to you, but guess what? Fermented foods. So I talked about the gut health connection. So those could be kimchi, kombucha, sauerkraut, kefir. There are a lot of different ways to get good, healthy bacteria in the gut through food, but you can also do it through a probiotic supplement. It's important that that is a part of your diet. So tip number 2, exercise. Guess what? Physical activity, including strength training and cardio, especially those 2 things, help regulate mood, help improve sleep, and manage weight. The SWAN study, one of the largest menopause studies in the US, and it linked consistent exercise with less depression, better health, better sleep, overall less hot flashes. And those patients reported that a lot of their menopause symptoms went away by just having consistent exercise. But remember, walking is not enough. You have to incorporate resistance training. We lose muscle. Seriously, we lose muscle every single year. Women lose 3 to 8% of their muscle mass per decade after age 30. So that means that in the first 5 years, this actually accelerates big time because you lose estrogen. So you lose this beautiful hormone that helps you build muscle, and most of the time you lose testosterone. So it's really, really important that you're building muscle. And the International Osteoporosis Foundation found that postmenopausal women lose 1 to 2% per year. So it really accelerates once you hit postmenopausal. So you want to make sure that you're building muscle. And one of the best ways to do that is incorporate resistance training. The other thing that muscle does is muscle is actually really important for metabolism. It's the best metabolic organ that you have. So when you build muscle, you're actually building this organ that burns calories at rest and in motion. So the great news is that if you want to kind of slim up a little bit, focus on building muscle, making sure that you're getting enough resistance training. The other thing that's important related to muscle is obviously bone loss. So when we lose estrogen, our ability to bone turnover actually goes down. And so we really want to make sure that we're focusing on resistance training for both muscle and bone. So again, loss of muscle mass leads to slower metabolism, increased risk of insulin problems like diabetes, and higher chance for falls and fractures. So resistance training, completely part of, for I think, every single menopause care, but certainly if you're looking for a non-hormonal option, it's awesome. So the third category is non-hormonal medications. So these are ones that are actually FDA approved. So if lifestyle things are not working for you and you're still having hot flashes, night sweats, memory issues, difficulty sleeping, then you can focus on non-hormonal medications. There are a category of medications called SSRIs and SNRIs, things like paroxetine, venlafaxine, and Celexa that have been FDA approved or studied that reduce hot flashes. They typically are a lower dose. They don't work for everyone, but they certainly are great if you're having a combination of depression, anxiety, and hot flashes. In a JAMA article in 2014, it was showed that they decrease hot flashes by 60%. So they're pretty effective drugs. In fact, Brisdell has been an FDA approved medication for a while for hot flashes. The second is gabapentin. We typically use gabapentin for nerve pain and seizures. In fact, actually, gabapentin is kind of this drug that's used for many, many, many different things in medicine. But it has been shown to reduce hot flashes and especially nighttime symptoms. In fact, it works really great to take it at night to help with you sleeping. So it is a non-hormonal option. There are different ways that people can use it for not only hot flashes, but mood issues and also sleep. And then there's an older medication called clonidine, which some people use for hot flashes. It's not my favorite kind of medication because it does have some side effects, but it is an option that's still approved for hot flashes. So these medications can be especially useful if you can't take HRT or you don't want to take HRT. And one of the newer ones specifically for hot flashes is Veozah, and it's FDA approved for hot flashes in women who can't take hormone replacement therapy. You will need to talk to a provider for sure about prescribing it as a relatively new medication, but lots of great input from patients saying it works great. So now let's talk about supplements, right? A lot of women come to me with a whole stack of supplements that they're taking for menopause symptoms. And some women want to do supplements before they actually do hormone replacement therapy. They want to actually see if supplements work. So remember, supplements are kind of a little bit different because they're not all created equal. They're not regulated like medications. So I always tell patients to consider them like medications because you can have drug-herb interaction or drug-supplement interaction. So remember, even though they're over the counter, you still want to make sure that you're safely taking it and in the doses that are required and making sure that you are getting appropriate monitoring. I have seen a lot of patients who take supplements and they don't really know why they're taking it and they're doubling up. So they may take black cohosh in a menopause supplement and then black cohosh separately. So you really want to make sure you know what's in those particular supplements. So speaking of black cohosh is one of the most studied herbs for menopause. There's lots of good research looking at a 2012 Cochrane review, which shows it might show mild improvement in hot flashes and sleep. There's kind of mixed reviews. You see studies that indicate it works and studies that indicate it doesn't work. Most of the studies that had severe hot flashes, there was not a lot of data supporting that it works quite as well as HRT. For sure, there's a lot of good studies looking at short-term use with black cohosh, and so it's an option, but just know that it's kind of a mixed review. Phytoestrogens, things like soy isoflavones. In fact, in Japan, where soy consumption is high, women in general report fewer vasomotor symptoms. So a meta-analysis from the American Journal of Clinical Nutrition in 2010 showed moderate benefit, especially in women who have good gut bacteria and good gut health. It works really well to help improve their overall vasomotor symptoms. One of my favorite supplements that I like to talk about is ashwagandha. It's an adaptogen. So adaptogens literally mean that your body needs to adapt to stress, anxiety, mood symptoms. And so ashwagandha is a neutral adaptogen. So it doesn't make you tired. It kind of helps you overall with just stress reduction, just feeling kind of overall more calm. And so that can be a really great option for women who are looking for something that's non-hormonal. And in fact, this year in PubMed, there was a study that was released with ashwagandha and shatavari. Now, it was a very, very small randomized clinical trial, but it did show that there was decrease in vasomotor symptoms, better quality of life, and actually they measured bone turnover markers. So how well someone's bone is turning over, and those markers actually improved. So it looked like there may be even some benefit from a bone perspective. But it is a very small study. I'll put the data in the notes here, but it's awesome that they're actually starting to study some of these things that are non-hormonal. I just want to caution you again, if you're going to take supplements, remember that they are medications. And so you need to make sure that you're properly monitored, especially if you're taking multiple supplements. You need the liver to metabolize those supplements because it's possible that you could get into trouble. So you need to make sure you think of it as a medication and how does it interact with the other things that you're taking. Finally, my last non-hormonal solution is mind-body therapies. Seriously, don't underestimate mind-body connection. There are several studies. In fact, a 2020 meta-analysis showed that mindfulness-based stress reduction, or MBSR, reduce hot flashes, improve sleep and mood. And also, if you combine it with, say, yoga, it helps a lot with strength training and decreasing joint stiffness. And overall, women found that as a very acceptable alternative to HRT. Cognitive behavioral therapy also can be helpful, especially CBTI. If you're having insomnia, it's clinically proven to help with sleep, anxiety, and even hot flashes. If you have severe hot flashes, it hasn't been shown to relieve those over other options, but it can help women feel better and overall have less stress. Acupuncture, love acupuncture. Non-hormonal, non-pharmaceutical, that's really gained a lot more attention in managing menopause symptoms. In 2016, there was a randomized clinical trial published in Menopause, found that women receiving acupuncture 2 times a week for 5 weeks had a 36% reduction in hot flashes compared to controls. So basically, those women had a third of their hot flashes get better compared to women who are not doing acupuncture at all. And it lasted at least 3 months past the treatment that they did. So they did 5 weeks of acupuncture, and then for 3 additional months, they had the benefits of it. Another review in 2018 concluded that acupuncture is effective in reducing hot flash frequency and severity, and the benefits are both in hot flashes, but also stress reduction. So it's not a cure-all, but for some women, especially those looking for non-hormonal solutions, acupuncture can be a great way because most cities have someone who's an acupuncturist, and it's really important to make that part of your holistic menopause plan. So if you're navigating menopause without hormone therapy, you have real effective options from nutrition, supplements, medications, mind-body therapies. There's no one-size-fits-all, but there is a solution that can work for you. If this video helped you, please like and subscribe. I post weekly videos on women's midlife health, and if you have questions about these, drop them in the comments. I do read them, and I do make videos specifically back to answer those questions, and I would love to hear your feedback.